So thank you guys for all making some time to join me for this presentation. My name is Tim Medcoff, attorney at Farhang and Medcoff. We are a full service law firm, but we do a lot and specialize in labor and employment issues. And I appreciate you carving out some time here over the lunch hour to learn a little bit more about the Families First Coronavirus Response Act, as well as the CARES Act, the Coronavirus Aid, Relief, and Economic Securities Act. So we've got a small group, just for housekeeping stuff. One, if you're not talking, just go ahead and mute your line just to avoid some background noise. Two, there is a chat function on the, in the program. So if you have specific questions, go ahead and add them there. Alternatively, since we are a fairly small group, if you want to just unmic and stop me at any point, that's totally fine. Hi, John, welcome. Feel free to do that as well, because I'm happy to take questions during the presentation at any time. So, and then if you don't have questions while we're going, I'll look through the chats and then answer questions at the end. So, as every presentation, some lawyer sued somebody, so I got to give you this is not legal advice. So that's this slide. So that being said, if you do have follow-up questions or need legal advice, anybody on our team can help you with that. So I want to start by talking about the FFCRA, the emergency paid sick leave and the emergency family medical leave that both went into effect yesterday for all small employers. Basically, the SBA, the law is defined as anybody under 500 employees is a small employer in the eyes of the law. So this statute, like I said, went into effect yesterday. So you should have a poster if you're a small employer, posted in wherever you conspicuously put your posters for all your employees to see. Technically, under the law, you're supposed to adopt a policy that explains these things, but a lot of times the poster will cover a lot of that. You do have a 30-day grace period. The government issued that advising that they're not going to enforce these new laws, at least stringently, for the first 30 days. So you do have a little bit of leeway to get your house in order, so to speak. You've probably had some questions asked of you related to these two new acts and how they work together, how they work with your current PTO, sick leave policies. So I'm going to try to answer some of those questions for you today. Specifically, as I mentioned, I'm going to talk about this in the context of private employers. If you're a public employer, then ping me up offline at tmedcoff@farhangmedcoff.com, and I'll be happy to give you some guidance on if you're a public employer. But I'm assuming most public employers, you have in-house counsel, whether that's the city attorney's office or the county attorney, who can give you guidance or has probably already circulated information for you on these topics. So one thing, even though this covers all employers that are under 500 employees, there are some exceptions and exclusions. So there is a small employer exception. If you're under 50 employees, you can avoid having to pay either paid sick leave or the emergency family medical leave if doing so would jeopardize the viability of your company to stay in business. There are some specific thresholds that need to be made. So you just can't arbitrarily say, hey, I'm going to go out of business, so I don't have to comply with these laws. You actually have to meet some thresholds to show, for instance, the revenue coming in is exceeded by your payroll, and therefore it's going to cause you to basically have to close your business. So there is a small business exception. In addition, there's a healthcare provider's exception. I've gotten lots of questions about this. What's the definition of healthcare provider? How broad is it? It's actually really, really broad. Even though a lot of dental offices, medical offices have reduced or closed mostly because there's been either directives from the ADA, the American Dental Association, or the American Medical Association, as well as the governor's office advising that all elective surgeries, procedures need to be stopped. those offices can still stay open for emergency procedures. But, now that we're in April, this law went into effect April 1st, yesterday. So healthcare providers are actually exempt, even if they're closed because of a governor's order or the American Dental Association or American Medical Association. They don't have to pay emergency paid sick leave, which seems counterintuitive because the real purpose of this statute is to provide benefits to those that need it. And if you're a healthcare worker on the front line, it's understandable that you don't want that person to take time off from work because you need them in the hospitals providing care to patients. But this also applies to, orthopedic surgeons, for instance, that their office is closed because they can't do elective procedures. So you could still rely on that exemption. Same thing on emergency responders. It's a very, very broad definition. It includes police officers, firefighters, paramedics, those sort of things, which you would characterize or believe to be emergency responders. But it also includes correction officers, public work employees, and a variety of other skill sets. So if you fall or think you might fall in the emergency responders definition, reach out to us at Farhang and Medcoff. We'll be happy to answer those questions for you and give you some clarity if that actually applies. So in terms of the emergency paid sick leave itself, you're a covered employee if you're a W-2 employee for the employer that's under 500 employees. You're covered whether you started working 2 days ago or 2 years ago. You're covered if you're a temporary employee. You're covered if you're a part-time employee. You're covered if you're full-time. But in order to actually get the benefit, you have to have a qualifying reason, which we'll talk about in just a minute. But if you do have a qualifying reason, then you're entitled to take time off related to COVID-19 as long as it's between April 1st, so yesterday, and December 31st of this year. Now, there is an exception. So for instance, let's say I've got 10 employees that work for me, and one of the employees tells me yesterday that they need to stay home because they have 2 school-age kids at home, so they need to take paid sick leave to take care of their kids, and that it's a single mother, let's say, that needs to take care of the kids. If I decide to reduce hours for all my employees or to shut my business down today just because business sucks, even though my employee yesterday, I paid her for paid sick leave at 2/3 of her standard rate, which again, I'll talk about that in a minute because there's different pay rates depending on what type of leave you're taking. If I close down my business starting today, she is no longer entitled to emergency paid sick leave because I've closed down my business. There's no work to be performed. Now, you need to be prepared to have backup documents to prove you had a legitimate business reason for closing or reducing your hours or doing the shutdown. Otherwise, you're subject to a potential discrimination claim that the Wage and Hour Division could pursue on behalf of that employee. But again, if you've got a legitimate business reason for your reduced hours or your furlough, or whether that be permanent, like a temporary shutdown, or you're closing doors forever, you do not have to pay that emergency paid sick leave. Even though the person asked for it and I paid for it yesterday, you don't have to pay for it tomorrow or today. So also want to just talk about the duration of leave. Let's assume that you're not furloughing, you're not reducing hours, you're still open and running your operation as best you can, either remotely or having your staff come in if you're performing essential functions. Speaking of which, I know this is a question that Jack's had and asked me offline before. The governor issued a proclamation, an executive order on the 23rd of March that defined all essential functions. In all honesty, it's really challenging to find a business that's not an essential function. Retail or dining in restaurants, those clearly you can't do because of, or potentially can't do because of the definition of essential function. But for instance, like if you're a retail store that provides parts for plumbers or electricians, you're actually an essential function because you're providing materials and supplies for the plumbing industry, which is a trade that is deemed an essential function. So we're we're sort of joking. The only real business that's not an essential function is Chuck E. Cheese. Pretty much everything's going to qualify as an essential business function. But that being said, if you have questions or concerns about that, I can either send you the governor's proclamation on that issue or give you some additional guidance depending on what your industry is. Getting back to the slide though, on the duration of the leave, for full-time employees, the statute says that you're entitled to emergency paid sick leave of up to 2 weeks, capped at 80 hours. So those hours can be split, like some employees work 50 hours 1 week and 30 hours the next. So they would be entitled to still 80 hours of paid sick leave. They're not entitled to overtime for the 10 hours of overtime that they typically work. They just get 80 hours straight time over the 2 weeks. If you have part-time employees, I've been asked a lot of questions. Well, how do I figure out how much emergency paid sick leave I have to provide to the part-time employee? So if they've been employed for 6+ months, then you just take their average hours that they've worked over the last 6 months and divide that by 26 weeks to give you your average hours for that part-time employee, and that's what they would be eligible to be paid as emergency paid sick leave for their 2 weeks that they're out sick with COVID-19 or other symptoms or caring for a loved one or kids. But if they haven't worked for you for 6 months, then you look to see if there's an agreement between the employer and the employee when they were hired about how many hours that they would be working each week. If you don't have an agreement on how many hours, then you just take whatever hours that they worked over whatever period of time they worked and then divide it by the time they worked to give you that number. Keep in mind that the emergency paid sick leave is an addition to your current PTO policies, vacation policies, and paid sick leave policies that Arizona law requires. So it's an addition to that, so it's a supplement. And I know that creates some hardships potentially for small businesses, but I'll talk to you a little bit about a credit that may give you some comfort and definitely a little bit of a reprieve. The other thing to keep in mind on the emergency paid sick leave is if you're actually sick with COVID-19 symptoms, or maybe sick and you're waiting to talk to a doctor, or you're symptomatic of something that could be COVID-19, you cannot use intermittent leave. And the reason why is the law wants you to get rest, stay quarantined, whether that's in your room or your house, to avoid infecting your other family members. And obviously, if you're working, even intermittently, you could be coughing, using a keyboard, and then unwittingly your significant other or your kids could then use a keyboard, touch their face or nose, and then contract the virus and be asymptomatic, and then going out playing with their friends or going to the grocery store or whatever, and then get somebody else sick. So if you are, you can't use the intermittent leave if you actually are symptomatic for your own illnesses or caring for somebody who may be symptomatic. But you can use it intermittently, whether you're a part-time or full-time employee, if you're teleworking, for instance, and you and your employer agree to allow you to use the time intermittently. So, for instance, if your kid is you're still lucky enough to have your child take naps, then you could basically take care of your kid until they nap. Then you could work intermittently while they nap, and then you take a break while the kid is up again until your significant other or somebody else comes home to relieve you, and then you work in the late afternoon or evening hours to do your work time. So you can use the sick leave intermittently, again, if the employer agrees and if there's an ability to do telework. Teleworking, by the way, is totally up to the employer's discretion. They can permit or deny it at their choice. Depends on what the business job duties or responsibilities are, and whether the employer has the technological ability, secured networks, and those sort of things. And if you do allow an employee to telework, you as an employer do not have to pay for Wi-Fi, phone coverage, or those sort of things. Those are not your duties or responsibilities. If the employee wants to telework, they have to provide those as opposed to you. Unless, of course, you insist or force them to do it, then you're going to want to talk to your lawyer about what your options are at that point. So as I mentioned earlier, there's some qualifying reasons. Many of you are probably familiar with these. The poster sets forth these 6 categories pretty clearly. Basically, 1 through 3 is if you've been sent home because of a quarantine order or ordinance from the governor, from the feds, locally. If you actually have been diagnosed by a healthcare provider to have to self-quarantine, or you're being symptomatic and you need to get diagnosed. There are testing now. Banner has a drive-through test system. A lot of employers, I've been getting questions, what do I do if somebody calls and says they may be symptomatic? Because this law is not perfect, and employees can game the system, so to speak. So if somebody calls and says they're symptomatic, normally under normal conditions, you can't ask employees about health issues. But when a pandemic is ongoing like it is now, you as an employer can ask some health questions like, hey, what are your symptoms? So I can evaluate if this is COVID-19 related, or if this is just sick time because you've got a migraine, for instance, and you're going to use the state paid sick time or our PTO policy to take that time off. So you can ask those questions, and then if they say that they may be symptomatic, then I encourage you to tell your employee to call their doctor. If they don't have one, tell them to call 211 or look at pima.gov /COVID-19 to get information on who they can call to get diagnosed. They could also call Banner, although Banner is going to probably refer them back to their healthcare provider. Access obviously can provide some support too if the employee isn't under a healthcare plan. But then if they are symptomatic or are seeking diagnosis, then you need to have them keep that paperwork because you're going to need it for a payroll credit that I'm going to talk to you about in a few minutes. In addition, if it's 4, 5, and 6 on here, there's different pay levels that we'll talk about related to these different conditions. But these are the 6 qualifying reasons that can entitle somebody to emergency paid sick leave under the new laws. So if you have 1, 2, or 3, which is here on the right-hand side, then you're entitled to full wage replacement. And so what I've done here is I've explained on how you figure an employee's regular rate of pay. It includes all of their pay that they've earned over the last 6 months, so their salary or their hourly rate of pay, plus if you paid them any commissions, bonuses, tips, piece rate, anything like that, that gets added into their base rate of pay. So in the example I've given here, the employee has been working for you for the last 6 months and they're paid $15,600, which if I remember right when I did this example, I think that was at $15 an hour. So I'm double checking my math on that. Yeah, that's at $15 an hour. So obviously over minimum wage. In fact, it's right there on my freaking spreadsheet if I just looked at it right. And then let's say you pay them $5,000 in bonuses or commissions. So then you add that in to get you to $20,000. You divide it by 10,040, which is for the 6 months time working full time, that gets you to $19.81 per hour. So for 40 hours, they get paid $792.31 per week. So under the act, if let's say they're COVID-19 symptomatic, they've been diagnosed with it, then they get to take 2 full weeks off. They need to self-quarantine. They get $792.31 per week for their wages because that's taken partially their commissions and their hourly rate over the last 6 months. That's less than the cap. So the cap is $511 per day, so $5,100 per week. For the 2 weeks. So they're under that obviously because they're getting paid $792 for the 2 weeks. So they would get 100% of that paid to them for that 2-week period. Now, if your categories 4, 5, and 6, again on the right-hand side here, then the employee is entitled to 2/3 of their regular rate of pay, capped at $200 per day or $2,000. In this particular example, you would take the $792, multiply it by 2/3 to tell you what their pay would be in that situation. So as I mentioned, there is a silver lining. There are some tax credits, and there has been some IRS guidance that's been issued since the act went into effect and was signed into law by Congress and the President. So the IRS has basically indicated that private employers, you'll receive a $100 payroll tax credit and it could be refundable. And I got an example here that shows both how it works. For the emergency paid sick leave paid to employees, as well as any allocable healthcare expenses and the employer share Medicare taxes. So most of us are not accountants or don't know how to necessarily calculate those things. The good news is most of us have payroll companies that are well versed on these issues, that we're already paying them to help us decipher these things. But if you don't, then this is a question that you could talk to your CPA about. And if you don't have a CPA, then I can get you the backup documentations for the guidance from the IRS to help you decipher this. So in the example I gave you a few minutes ago on the employee that makes $792.31 per week, so that's what you're paying them for sick leave for the first week, right? So let's say you pay $1,000 in payroll taxes each week. So when you go to pay your payroll taxes at the end of the quarter, then you would actually, instead of having to pay $1,000 for that first week, you'd be paying $207 or almost $208. So that's a difference of $1,000 that you'd normally pay in payroll taxes, subtracting what you paid in emergency paid sick leave. So it's basically giving you a dollar for dollar credit, so you're not having to write that check later to Uncle Sam. The bad news for you as an employer is you're having to front load it to the employee to pay them for sick time when they're not providing services to you. But the good news is you're getting it on the back end with your payroll credits, so that you're not having to write a check and then waiting for a refund from the government. Now, the second example I have here, the second bullet point, let's say you pay $500 a week in payroll taxes. Well, in this example, you've now paid more in sick leave for that week than you paid in payroll taxes, so you're entitled to a refund of $292.31. So the IRS has also issued some guidance on this. They've set up an emergency sort of priority to issue refunds, but again, it appears that that refund will be issued within 3 weeks of you submitting it, but most employers are submitting their payroll taxes at the end of the quarter, so you're again having to front the money and not getting the refund for an extended period of time, depending on where it is when the person utilizes the sick time, vis-a-vis when your quarterly payroll tax payments due. So again, we're talking about the IRS here. So they've said that they're targeting to get payments back within 3 weeks of you submitting the application, the Form 7200. But because we're talking about the IRS, I've been telling my clients, don't hold your breath about getting that check within 3 weeks, because as we know, the IRS isn't always timely about getting refunds on tax returns. So good luck getting your money back from them on a payroll tax credit quickly. Although, fingers crossed, you will see it within a month or so of when you submit that application. So that's the emergency paid sick leave. So I want to talk now about the Emergency Family Medical Leave Act. There are some things that are very similar. For instance, the definition of a private employer is the same. The exceptions, exclusions are the same. So small businesses, healthcare providers, emergency responders, and the like. Here's where it differs, though, starting with the duration. So there is an eligibility requirement. So the first thing you need to do as an employer is determine if the employee has been employed with you for at least 30 days when they ask to start their leave of absence or emergency family medical leave. If they haven't hit the 30 days, then you can deny it until they hit the 30th day working for you. Secondarily, you need to determine if you have provided FMLA or obliged to provide FMLA coverage. So if you're an employer over 50 employees within 75 miles, then you are subject to the Family Medical Leave Act. Congratulations, right? If you are subject to that act, then you need to look to see if this employee took any FMLA time off within the past 12 months. If they did, let's say they took 2 weeks off for to get their knee scoped, and then they took 2 weeks, like they had the procedure, and then they had 2 weeks off to recuperate from the surgery. So now, instead of 12 weeks of FMLA, they're only entitled to 10 total weeks of FMLA. The first 2 weeks of which are unpaid unless they substitute in the emergency paid sick leave if they're eligible for it, or their own private, through your personal time off or sick leave policies that you may have. So you got to make sure that you've looked at those two eligibility issues first, because an employee is not entitled to stack FMLA time on top of emergency family medical leave time. They only get 12 weeks total within the past 12 months. So you definitely want to look at that. So let's assume that they haven't taken, either that you're not subject to the FMLA because you're under 50 employees, or this employee did not take FMLA prior to the COVID-19 crisis and this law going into effect yesterday. With that assumption, the first 2 weeks, as I mentioned, of emergency family medical leave is unpaid, except that the employee can substitute the emergency paid sick leave to get paid for the first 2 weeks at 2/3 the regular rate of pay, because again, the emergency family medical leave is when you're caring for a sick child. The next slide talks about the qualifying reasons that you're unable to work because you're caring for your child, a son or daughter, either biological or adopted, or that you're otherwise are responsible for caring for, like if you're a grandparent taking care of your grandchild, and you're solely the one responsible and they're dependent on you, then that would qualify. And it's due to the healthcare emergency, i.e. their school's closed. So getting back to the duration. So the first 2 weeks is unpaid, except they can substitute in. Now you may be asking, well, why wouldn't an employee substitute in? So let's say that you have no PTO, or they have no accrued PTO or sick leave because they used it all previously, or they've only been on your payroll for 90 days, so they haven't yet accrued personal time off or paid sick leave. So they may not decide to use the emergency paid sick leave because under the emergency family medical leave, they only get paid that at 2/3 their regular rate. So they could get sick, for instance, with COVID-19 a month from now, and if they didn't elect to use their emergency paid sick leave, if they're diagnosed with COVID-19, they may want to bank that and use it at full rate. As I talked to you earlier, if you're sick with COVID-19, you get paid your regular full rate, whereas if you're caring for your kids, you can only get paid at 2/3. So once you get past the first 2 weeks, weeks 3 through 12, the employee gets paid at 2/3 the regular rate of pay, and again, you're eligible for the tax credit. A lot of questions I've gotten from employers is, should I allow employees to use their accrued PTO, vacation, paid sick leave time to make up the difference, because it's a third difference. Kind of like the workers' comp scenario, where workers' comp pays 2/3, and some employers allow the employee to use their accrued PTO, sick leave, vacation time to make up the difference so they get a full paycheck. That's totally up to your discretion of whether you do that or not. I oftentimes recommend employers go ahead and allow employees to utilize the PTO and vacation for that purpose. Maybe not the paid sick leave, but definitely the first two. And the reason why is most employers pay that out upon separation anyway. So you're just reducing your liability when the employee quits down the road or is fired down the road. And it's a goodwill gesture, right? You're trying to take care of your people and demonstrate that you've got a kind heart. And this is the other thing I've been talking to employers a lot about, is think proactively about where you want your business to be 2 months from now, 5 months from now, a year from now. Because at some point, we're going to overcome the COVID-19 mountain, right? And if you are known as an employer that's compassionate, takes care of your employees, when you round this corner and can hire more people, Tucson's a big, small town. Employees talk to each other. If you're seen as a compassionate employer, you're going to have the pick of the litter of employees. Because right now, the stats came out yesterday, 6.7 million people applied for unemployment last week. The week before, it was 3.3 million. So we're at 10 million people that have applied for unemployment in the last 2 weeks alone. To put this in context, when we had the recession in 2008 because of the housing bubble burst, the highest level of unemployment per week was 500 people. And the entire recession, because of the housing bubble burst, was less than the 6.7 million people that applied for unemployment just last week. So I understand that a lot of those people that are applying for unemployment are lower level employees, like restaurant employees and retail establishments. But there are other businesses that have done layoffs and cutbacks. and I'll talk about this a little bit under the CARES Act. So you as an employer, if you're known as compassionate and caring for your workforce, that's going to pay you huge dividends when you come out the backside of this crisis. So that's the other reason why I encourage employers to think about allowing their employees to use PTO vacation time. Again, your discretion, you don't have to do it, but I think it's going to pay you huge dividends if you do. As I mentioned, the qualifying reason for the Emergency Family Medical Leave Act is you're taking care of a sick child at home. That's the only reason why you would qualify for the Emergency Family Medical Leave Act. And the reason why is typically if you're sick yourself, then you can rely on Family Medical Leave Act time off. And this statute, the Emergency Family Medical Leave Act, does provide pay, unlike the Family Medical Leave Act, which is still unpaid. But the other act, the Family Medical Leave Act, if you qualified for it, provides job security and requires the employer to put you back to the same or equivalent job. Same thing under the Emergency Family Medical Leave Act. Now, there is some exceptions to that if there's some sort of hardship, business hardship, that you had to lay off people, and again, you can prove good faith. But for the most part, most employers are going to have to return people back to their job once they return from the Emergency Family Medical Leave Act. And as I mentioned earlier, you can, as an employer, agree to do this intermittently on the Emergency Family Leave Act. So instead of them taking 8 hours a day for the full week, maybe their significant other can watch the kids Tuesday, Thursdays, and your employee watches them Monday, Wednesday, Fridays, so then they work Tuesday, Thursday, either from home or at the office. Alternatively, you can do the intermittent where they're working partial days, where they're not working in the morning, work when the kid naps, and then works in the afternoon, and maybe they put in 4 hours of work a day. So then you would be giving them 4 hours of emergency paid sick leave at 2/3 plus full rate for the other 4 hours that they work. The tax credit basically works the same, except, again, we're talking about 2/3 of their pay. So in the example, it's the same numbers as before, but you got to take 2/3 of their pay, so they're going to make $528.23 in this example. So if you pay payroll taxes of $1,000, then you're going to get a reduction on your payroll taxes. So now you only have to pay $472 roughly. And then if you pay $500 in payroll taxes, this is where you're now going to have to ask the IRS for a refund of $28.23, which again is not huge dollars, but in today's world, every penny counts. So the other question I've gotten a lot from employers is, what sort of documentation can I request, and what about the Arizona paid sick leave statute that says I can't require documents until somebody's out for 3 or more days? So this is where there's some ambiguity in the law because the Prop 206 law that went into effect back in July of 17 does not create an exception for emergencies, pandemics, those sort of scenarios. But I have been telling clients federal law always trumps state law from that standpoint. So therefore, the federal law says that you can require the following documents and information depending on if you're on emergency paid sick leave or emergency family leave. So if the qualifying reason that they're requesting, you can ask them to document that, get a statement from their doctor for the reason why they're unable to work, including teleworking if you provide that option to your employees, and the dates in which the leave is requested. If it's a quarantine or isolation order, then you need to pull a copy of that or get the document from the healthcare provider who's advised the employee to be self-quarantined. One of the other questions I've been asked, which again is still sort of unanswered, is because the governor's issued kind of the stay home, stay connected, stay healthy proclamation, executive order that he just issued on Monday that went into effect Tuesday at 5 o'clock. Some employers ask me, well, does that qualify as a isolation quarantine order? And the answer is it's uncertain because I would say if you're a non-essential business, yes, then that would suffice because you've been told that everybody needs to stay home to avoid the spread of the virus. If you're an essential job provider, however, I would say that that's not sufficient to rely just on the isolation quarantine order because it only applies to non-essential jobs. In other words, the employee needs to have symptoms of COVID-19 or been diagnosed as COVID-19 in order for you as an employer to be obliged to provide the emergency paid sick leave. And this matters for you because if you provide the leave and you don't have the proper documentation, then you're not going to be eligible for the payroll credit that we talked about. On the emergency family medical leave, you need the documentation, the following documentation. The employee must give you documents that their school's been closed, either from the website or the government order closing the schools, which the governor just did, extending it through the end of the school year. And again, that's going to apply for paid and unpaid weeks. So if the employee opted not to get paid for weeks 1 and 2, or they already used their emergency paid sick leave, because let's say this is now May, as opposed to April, and they were sick with COVID-19 the first part of April, then they would be taking that first 2 weeks off without pay if they had no accrued PTO or sick leave under your policies as an employer. The one thing that we still don't have guidance on, though, under this Emergency Family Medical Leave Act is what about time off that employees taken to watch their kids after school would have been out of session, right? We don't know the answer to that question right now. I mean, my gut tells me that this should apply for when the kids are in session. But if the parents could say, well, look, I would have put them into the Y to go to basically daycare or a daycare facility, then I think the answer is they're still entitled to it. If they would have just had the kids stay home with another family member, then I think the answer is no, they're not entitled to it because, again, they've got to give you documentation of closure. So if their school daycare facility or their healthcare provider, like if you've got a nanny, or a parent or another family member that takes care of the kids, if they give you documents that they can't take care of the kid because they're at risk for getting COVID-19 or other reasons, then I think that would suffice. But if it's past school and they have other arrangements, then I think you could deny the request. But again, I tell you, do that with caution. Talk to your lawyer to make sure that you're all square before you pull the trigger on that. So that covers the first 2 acts. Just double checking my time. So now on the COVID Aid, Relief, and Economic Securities Act, I do want to touch base on this. A lot of questions have been asked about the payroll protection program and how that works. So just want to talk a little bit about that program in particular because that's the one that affects most small business owners. And I'll talk to you about 2 different doors depending on whether you've laid off anybody or not. So I've been telling all the clients that call me that this is a great program. If you're affected in any meaningful way because of the crisis, where you've had any sort of lost revenue or anticipating any lost revenue, you should be applying for this loan. It's a loan that can be converted to a grant depending on if you meet the criteria, and I'll talk to you about that in a second. But it's a zero fee loan, non-recourse, non-collateral. What that means is you do not have to sign a personal guarantee. You do not have to put up any business assets, personal assets as collateral. This is federally guaranteed in its entirety. So if you end up defaulting on it, the federal government is going to pay the bank whatever the default amount is that you owe. So you're going to be able to, worst case scenario, you have to close your business after getting that loan. You're not on the hook to having to pay it back. The loan is calculated by taking all of your payroll costs over the last year, which includes things that are not traditional payroll costs. For instance, monies that you pay your independent contractors, such as attorneys, CPAs, payroll companies, and the like, capped at $100,000 prorated. So, 1 month of that, if it's $100,000, would be $8,300 that you could borrow 2.5 times. So roughly about 20 grand. Almost 21 grand that you would qualify for to add into your loan for those independent contractors, assuming it was at 100,000 or more. And then all of your payroll costs for your employees, it includes owners and others. And then you add all that up, divide by 12 to give you your average monthly payroll. And then you multiply that by 2.5 times to get you the loan amount. Now, if there's employees on your payroll that are paid more than $100,000, then you only get credit for the first $100,000. You don't get any credit for beyond that. You're eligible to apply if you've been harmed by COVID-19 between February of this year and June 30th of this year. You have to give a certification with the SBA lenders. The loans are actually being funded by third-party lenders, not by the SBA, because those of you that are on the phone that have been trying to apply for the SBA EIDL, the economic income disaster loan, know that it's been a nightmare to get your application submitted. The system keeps crashing. You can't get the application submitted, and it's taken a long time for the SBA to process it. The reason why is they're understaffed and there's too many people applying for it. So I've been telling clients, if you are going to apply for the EIDL, if you haven't done it already, you still can, to do it late in the evening, after 8 o'clock Arizona time, when most of the people on the East Coast are already in bed, because that will increase your chances of getting your application submitted and approved. The EIDL includes $10,000 non-recourse dollars within 3 days. I don't recall if that's 3 days of funding or 3 days of submitting the application. But again, that's dollars that you can utilize immediately, and it's forgiven entirely. There's no recourse if you don't pay it back. You can apply for the EIDL in the PPP program, the Payroll Protection Program, but there are some restrictions that if you have questions about that, please ping me offline. And then the payroll protection, as I mentioned, has 2 doors. So a lot of employers have asked, well, what if I've laid off people? Can I still apply for the payroll protection? The answer is yes. So door number 1 is, let's say you apply for the payroll protection and you're seeking $100,000. Let's just say that's the number that your payroll costs at 2.5 times equals. Then you go to your local lender, submit the application. Once it's funded, let's say it's funded on April 15th. If you keep your payroll level at the same level because you've not laid off anybody prior to getting a loan, you can reduce your salary by up to 75% and still get a dollar-for-dollar forgiveness. If you use that money to pay payroll costs, use it to pay rent, use it to pay utilities, or use it to pay down an interest on your mortgage, any of those 4 categories, you will get dollar-for-dollar forgiveness, converting that loan into a grant. And then any dollars that you don't spend, you could prepay without penalty to the lender. You just have to pay a small amount of interest that you accrued for that 2-month period or so, which at 4%, which is the highest that this loan can come in at. And it could be as low as whatever the lender wants. I actually talked to a lender today, and the SBA had a call with a number of lenders and saying that they were recommending that the loans be done at 0.5%. My banker I talked to basically told me if that's the case, there's going to be a lot of banks that are not going to do these SBA loans because they're not going to make any money on it, and it's going to cost them more in overhead to process and manage the loan than it is what they're going to make on it. So I doubt the loans will be that low, but they'll probably be north of 1%, probably in the 2 to 3% would be my guess. Probably similar to the EIDL, which is at 3.75 for for-profits or 2.75 for nonprofits, 501c3s. So if you do on that door number 1, keep your employee full-time equivalents at the same level, then you're going to be able to qualify for a full grant reduction of that loan. Door number 2, you have had layoffs between February 15th and April 26th, which is the cutoff for the PPP loan for layoff purposes. You just have to then rehire your full-time equivalents by June 30th of this year. So I've had some clients say, well, should I then just wait to apply for the loan to, early May? Because then it gives me a better chance to be able to get my payroll back to full-time by June 30th to allow me to get my full reduction on payroll costs, etc. I'm like, yeah, you can try that, but the danger is we're talking about a capped loan at $350 billion. Yeah, that's a big number, but everybody I know that I'm talking to is telling their clients to go apply for this loan. So if you wait, you might be out of luck because the money could all be allocated, so there might be no monies left. So that's door number 2, is that you lay off people. You just have to rehire them by June 30th, and then you'd be eligible for a loan forgiveness dollar for dollar if you do meet that criteria. So the loan is available to any small businesses, generally less than 500 employees. It's available to 501c3s. It's available to sole proprietorships. If you're self-employed, you're eligible. You just have to have been in business by February 15th of this year. So if you just opened your business last week or last month, sorry, you're not eligible for this loan. So the loan size, as I mentioned, it's 2.5 times your payroll costs, assuming you were in business between February of 19 and June of 19, then you're going to take your monthly payroll cost for the prior year of when you apply. If you weren't in business for those months, then you're going to look at your payroll cost for June and February of this year. And then there's some information there if you did take out the economic injury disaster loan, that you can refinance that and roll it into your PPP loan. And you can also take whatever you acquired for that EIDL loan and add that to your payroll cost to push up your loan amount that you can seek. So here's the definition of the payroll cost. Whoop, back up there. So again, the salaries capped at $100,000. Any monies you paid for sick leave, any monies for separation pay, your group health care benefits, including insurance premiums, any 401k matches that you've done, any taxes that you've paid for your employees, and the payments to independent contractors capped at $100,000, prorated for that month, which is $8,300 roughly. So you add all that stuff together to get your payroll costs. Then you've got to subtract, for instance, if you've got employees over 100,000, you can't get compensation or add that into your payroll costs. If you paid any taxes under those chapters of the IRS code, those would have to be subtracted. Any compensation for employees that live outside the U.S. would have to be subtracted. So those of you that do business down in Mexico, if those employees live down there, it would have to be subtracted. And then if you paid any money for emergency paid sick leave or family leave, it would be subtracted. So as I mentioned, door number one, you've got 8 weeks to spend the money. If you had no layoffs of anybody, then anything you've spent on payroll costs, interest for mortgage, rent, and utilities, you would be then able to get that forgiven, potentially dollar for dollar. And you're going to then apply to your lender, the same lender that approved your SBA 7A loan. And that's the other key. You should be talking to your bank now, your financial institution now, whether it's a credit union, bank, or otherwise, to find out if they've got an SBA loan officer who's been approved by the SBA to process 7A loans. If they don't, then call me, email me, and I can give you a list of financial institutions that do have approved 7A lenders, some of which will take and process your loan even if you don't have an account with them. Others will tell you that you have to open an account with them and meet their minimum thresholds to process your loans. But you want to get on top of this now so that you can get to the front of the line with your application just to avoid the money running out. In addition, you're going to want to start gathering the information that you need for payroll taxes. Oftentimes, you're going to need to work with your payroll company or your accountant to gather that information. So what happens after the forgiveness period? So whatever you don't have forgiven is still a pretty sweet loan. Because you get interest deferred for up to 6 months, maybe up to a year, depends on the lender. The loan is going to be amortized over 10 years at a maximum of 4% interest. It could be less than that. I think it's going to be less than that because I think it's going to match the EIDL loan. Otherwise, why would you roll the EIDL into the PPP at a higher interest rate? And again, it's non-recourse, non-fees, no collateral. So it's better than any loan that you could have qualified before this statute got enacted. So that's why I've been encouraging my clients to look at long and hard at this loan if you qualify. Now, there are a couple other programs under the CARES Act, like payroll forgiveness reduction up to 50% and some other things. You can't qualify for both. You either apply for the PPP or kind of those payroll tax benefits and things. That's where you're going to need to pay somebody a lot smarter than me who crunches numbers to look at what's in your best interest as an employer, whether the payroll credit is in your best interest versus this payroll protection program. Other considerations, you're only entitled to one PPP loan, and that's for each tax ID number. So if you were lucky enough beforehand, for instance, let's say you're a McDonald's owner-operator and you set up each of your McDonald's as single asset LLCs under different taxpayer ID numbers, then you can apply for PPP loans for each of those restaurants that you own. And as I mentioned, it's a 7A lender that are eligible to fund and process your applications. There is a lot of misinformation out there, so you want to make sure that you are talking to a lender that has already been approved. I don't recommend that you work with a lender who says, I'm getting approved. The government will approve additional lenders, but I have no idea when that's going to happen, and you want to be at the front of the line, not at the back of the line. And then there's that other assistance through the EIDL that I mentioned and other loans that you can qualify for. So with that, I'm going to look at your slideshow presentations under the chat to see if there's any questions there. It looks like we've got 3. So let's look at these. So looks like maybe Martin confirm. So yes, Martin, if it's now, whether it's before April 1st or after April 1st, if you shut down your business either in its entirety or partially, if it's an entire shutdown, then you do not have to provide emergency paid sick leave or emergency family medical leave to your employees if you've done a complete shutdown. If you've done a partial shutdown, then let's say you've reduced all your employees from 40 hours to 20 hours, then they would be eligible for emergency paid sick leave or emergency family medical leave at the cap of 20 hours because that's what your work hours are that they're eligible for. And then you can make a business decision if you want to allow them to use their PTO or vacation or sick leave to get a full paycheck. That's, again, up to your discretion. Next question, if they are forced to shut down, what's the best way for the PPP loan to be forgiven? So same issue that I talked about, door number 2. So if you do I'm representing a number of dentists right now, right? And all dental offices have pretty much shut down except for emergency procedures, i.e. a crown falls out or somebody breaks a tooth and they need to get in to see their dentist. Outside of that, they've really just done a complete shutdown of all their employees. Most of them have, not all of them, but most of them have. So if you did a complete shutdown for all of your employees except for you, the dentist, and maybe one front office person who fields all the calls and deals with the emergency calls and things, and then one assistant, then you can do a shutdown for everybody else, and you can still apply for the PPP because you're paying 3 people partially or full wages, right? So you may be paying yourself full freight or at least partially full freight, like $8,300 a month if you're a dentist, because presumably you're making more than $100,000 a year. So you can still apply for the PPP. You just have to get your full-time equivalents back to 100% if you can by June 30th of 2020. If you do, then whatever you paid for your salary and the salary for the other 2 employees that you may have employed, plus whatever you paid in lease payments, plus whatever you paid in utilities if you're obliged to pay utilities, if you're leasing the property, then those monies would be forgiven dollar for dollar. If you then chose to pay yourself additional money because you're used to a certain standard of living or had other bills that you had to pay that you weren't expecting and you're not making enough income, then you could use that money to pay yourself additional dollars or pay somebody else. And you could still apply for the PPP. You're just not going to have as much forgiven. The bonus up when they return to work and pay them. So yes, you can do that. I just caution employers to be very careful about those sort of promises with your employees because if you sign a written contract like a promissory note that you're going to basically make somebody whole if they are loyal to you, for instance. What happens if your business is failing and not doing well? You're now having to honor that bonus or that agreement that you signed in writing that could hamstring or handcuff your business. So the other thing that you can do is under the CARES Act that I haven't talked about is if you basically do a partial layoff, like reducing people to 20 hours or a shutdown down to no hours, those employees can go apply for unemployment benefits. And in Arizona, they can recover potentially up to $21 an hour in unemployment benefits, because it's $600 under federal government and potentially $240 under state, which is $840 a week divided by 40 hours is 21 bucks an hour. Now, some of your employees maybe get paid less than 21 bucks an hour, so they're actually going to be happy if you lay them off or furlough them. I recommend that you furlough the employees as opposed to doing a layoff in that situation, though, because then you retain the discretion to call them back to work when your business picks up. And if they refuse to come back to work at that point, you could contact Department of Economic Security and say, I have work for this person to do, and they're refusing to come back to work, so therefore they wouldn't be entitled to unemployment benefits at that point. So if you do a furlough as opposed to a layoff, that allows you to retain control. I just then recommend you check in with your employees once a week to see how they're doing, and to let them know that, hey, we're still on a temporary shutdown because we can't see patients or we can't open our doors to clients. So I think that takes care of Martin's questions. Celine, let's see. There's a lot of discussions about getting documentation from doctors. However, it seems that so great question, Celine. So I've been telling employees or employers, hold off requesting doctor's notes, at least initially, because the healthcare system's pretty strapped. But if it's a primary care physician, they're not as strapped as, for instance, hospitals and others. So again, under the emergency paid sick leave and the emergency family medical leave, you're entitled to request documentation from the school or the doctor. And you need that documentation, frankly, in order to get the payroll credit. So, the employee may not be able to get the documentation right away, but you just need to tell them, I need you to get that documentation as quickly as you can. If the doctor is jammed, then, then have them send it to me next week as opposed to this week. And if you can get the employee's permission, you can say, look, can you give me sign this authorization? Then I'll contact the doctor to get the information, so you don't have to deal with it, especially if they're sick with COVID-19. The last thing you want to have them do is be stressed about getting the doctor's note. So just tell them, get well. When you feel up to it, give me the doctor's information, and I'll send you an authorization, or you can send me an email saying I'm authorized to contact your doctor to get a doctor's note that you're home sick with COVID-19, based on their verbal conversation, because they're probably not seeing the patient to confirm it in person, but they're doing it verbally based on what they're told. And then the employees should be going to get tested, so they can get the test results and provide that to you as well, and that might suffice or should suffice, because obviously that shows that they've been on COVID-19, and you just need to reflect the days in your records when they went on that leave. I do recommend that you keep all of that information in a separate file from their regular work file, because it is health information that should be subject to more protections than a regular employment file that you have in the personnel file. The other thing to keep in mind, if you do have an employee who tests positive for COVID-19, you have an affirmative duty to keep that information confidential on a need-to-know basis. So you might be able to tell the supervisor, but you shouldn't be telling all the coworkers that Tim Medcoff is out sick because he has COVID-19. Rather, you just need to say that Tim is out ill and we're taking precautions, or that an employee is out ill and we're taking precautions that they may be positive for COVID-19, so we're sterilizing the work environment. We've talked to the janitorial crew to clean the environment more thoroughly, those sort of things. But you should not be revealing the person's name unless the person authorizes you to do so, or it's a need-to-know basis for the supervisors. That being said, for most small employers, employees are going to be able to put two and two together to figure it out. Nancy asked a question. Do you lose the emergency sick leave or emergency family leave tax credits if you take the Payroll Protection Act? No, you do not. You still get that protection. There are two different things. You can qualify for both. Businesses, two different tax ID numbers. Can you get two different loans? Yes, you can. You lay people off because of no revenue coming in. You apply for the PPP and bring everybody back, give them a bonus to cover the pay that they would have made had they not been laid off. Would that be forgiven? Yes. Any bonuses, anything that you pay, commissions, bonuses, compensation during that 8-week period, is forgiven. Let's see. I think that covers it for the questions. I know I talk super fast. The good news is I kept you at exactly 1 hour. Thank you for the questions. If there are additional questions, go ahead, Jack.
I just wanted to say great job. Thank you.
No worries. And it looks like somebody just helped. Thank you, Nancy. Appreciate it. If you do like my presentation, my name is Tim Medcoff. If you didn't like the presentation, my name is Ali Farhang, that guy.
Good one.
Thank you, everyone. Please join us tomorrow. We have another Knowledge at noon. Abby Gontarski is our presenter, and it will be COVID-19, what comes next for businesses. So tune in again tomorrow.
Thank you all. Take care. Be safe.
Thanks, Tim. Good job.
Thank you.
Thanks all. Bye-bye.
Bye-bye.